In 1983, Congress passed a law that decoupled Social Security full retirement age with Medicare age. Nowadays, you're eligible for full retirement of Social Security benefits closer to age 67 than 65, yet you're eligible for Medicare at 65. Why does this matter? Well, it's creating quite a problem, and Congress can fix it. We just have to encourage them to do so. Hello, I'm Daryl Russell, a licensed agent and director of training with Affordable Medicare Supplements, or AMS for short. We're an independent insurance agency, and we help you learn Medicare so you can avoid costly mistakes, penalties, and help you maximize your Medicare coverage with confidence. If you're new, be sure to click subscribe, and all links to any publications or websites we mention in this video you can find linked in the description box below. So let's get started. Well, basically, the biggest problem that we have nowadays is many people don't understand that just because their Social Security retirement may not start till 66 in 2 months, 3 months, 4 months, what have you, they're actually eligible for Medicare Part A and B at age 65, even if they're not retired. And if you're not drawing Social Security benefits, you have to sign yourself up manually, and you don't get any notice on that. But there is currently a law in Congress that I wanted to talk to you about and encourage you to help encourage our congressmen and senators to vote on this act. So let's take a look at that legislation. It's called the Bennies Act, or Beneficiary Enrollment Notification and Eligibility Simplification Act. And it's a mouthful, I'll grant you that. But what does it mean? Well, there's some very complex Medicare enrollment rules, and these are causing tens of thousands of older adults and people with disabilities to face lifetime fines, coverage gaps, and other harmful consequences. With fewer people automatically enrolled in Medicare, by that meaning they're drawing their Social Security at age 65, and 10,000 baby boomers aging into Medicare each and every day, more people are new to Medicare must actively enroll themselves in the program. Individuals who miss their initial Medicare enrollment window may pay lifetime late enrollment penalties, experience very long gaps in their outpatient health coverage, or face unaffordable and unexpected out-of-pocket health care costs. In 2018, 760,000 people with Medicare 760,000 people with Medicare were paying a Part B late enrollment penalty, or LEP, and that average late penalty amounted to nearly a 28% increase in a beneficiary's monthly premium. That's staggering. Well, the bipartisan, bicameral Bennies Act would direct the federal government to provide advance notice to individuals approaching Medicare eligibility. So you're turning 65, the government's requiring itself to send you a notice telling you what you need to do. Makes sense to me. Basically, it's about your basic Medicare enrollment rules, filling a long-standing gap in education. The Bennies Act would also eliminate needless multi-month coverage gaps in Medicare by mandating that Part B insurance begin the first of the month following one's enrollment during the later months of their initial enrollment period and during the general enrollment period. So what does that mean? Well, if you have to sign yourself up for Medicare, you have a 7-month window, and think of the month you turn 65 as the center point. So you have 3 months before the month you turn 65 that you can enroll, and if you sign yourself up on the Social Security site, you get your coverage effective the first day of the month that you actually turn 65. Beautiful. If you sign up in the center point, the month that you actually turn 65, then your coverage is effective the first day of the next month. Okay, not so bad. But this is what the law is trying to change. If you sign up 1 month later, your effective date is delayed 2 months after the month you sign up, and as many as 3 months after. So what does that mean? Well, in other words, if you turn 65 now in the month of June, and you have to enroll yourself because you're not receiving your Social Security benefits. And you enroll yourself 1 month late because you didn't know, and it's July, but you turned birthday in June. Your Medicare effective date will be delayed 2 months after July. So you signed up in July, the 2 months, one is August, one is September, meaning even though you signed up in July and you were eligible for a June 1 effective date, you're now getting an October 1. This law, if we can get Congress to pass it, would actually make it that if you signed up late in July because you didn't know, it'll be effective the first of the next month, 1st of August. Much, much simpler, much more Medicare beneficiary friendly. The Bennies Act would also reduce confusion by aligning the annual General Enrollment Period, or GEP, with the annual enrollment period for Medicare beneficiaries. This way, it would allow enrollment period for private Medicare Advantage and Part D drug plans to coincide with the general enrollment period. So right now what that means is if you didn't sign up for Medicare Part B because you didn't know and you got locked out, your opportunity to enroll in Part B only happens once a year. That's the GEP, and that occurs January, February, and March of each year, and it's effective the following July. So if you want an Advantage plan, you have to have A and B. Your enrollment period for Advantage plans ends December 7th. You can't even sign up for B until January 1. So this would make it a little bit easier for people to do that. A bipartisan group of former administrators of the Medicare program support the Bennies Act and urge Congress to pass the bill. So here's a list of the original sponsors, both in the Senate as well as in the House. And there's more than 85 national and state organizations representing older adults like AARP, Aetna, AFL-CIO, Blue Cross Blue Shield organizations, Medicare Rights Centers, and many, many more. So we encourage you, and I encourage you folks, contact your local congressman or woman and tell them to support the Bennies Act, Senate 1280, House Resolution 1277, because we need to simplify enrollment and coverage effective dates of Medicare. But after you do that, folks, please, please share this information with your family and friends and ask them to also contact Congress to pass this Medicare beneficiary-friendly legislation. Here's the rub. This law was introduced in Congress in May of 2019, and there have been earlier versions as early as 2016. Currently, this bill is rated as having a 3% chance of becoming law. Let me show you that here real quick. This is a website, and again, we'll have this linked in the description box below, but it's actually showing the bill itself, and down here, it was introduced May 2nd, 2019. The bill is in the first stage of the legislative process. It will typically be considered by committee, and it has a 3% chance of being enacted. What a crock. This is simple, folks. It's common sense. There's another great article on this. Again, we'll include the link in Forbes. Talks a little bit more about some of these things. But let's get on this one, folks. Let's make Congress do their job and stop bickering and fighting and carrying on like a bunch of spoiled children sometimes. So anyway, forgive me for getting on my soapbox. Anyway, as always, we thank you for watching. And if you like the video, give us a thumbs up or leave us a comment. If there's a particular topic you would like us to make a video about, leave a comment in the section below and we'll do our very, very best to make that happen for you. Be sure to click the subscribe button so you'll get automatic updates on new videos as we release them. I'm Daryl Russell, Agent and Director of Training at AMS. Good day, folks.